Welcome, everyone. My name is Marcus Castrejón, policy advocate with the California Pan-Ethnic Health Network, located here in the Sacramento office, and I will be facilitating our webinar today. Before we get into the webinar, I wanted to do a quick sound and visual check. So if you can hear me and see the screen, please use the hands up icon in the browser. And if you are having trouble with sound or seeing the screen, send a message through the Q&A chat box and someone will assist you.
You're good to go.
Okay, thank you all for that. So we just wanted to thank you all for joining the third webinar in Mobilizing for Health Equity training series. Training series is open to all, but designed to support the work of the Having Our Say Coalition, statewide coalition comprised of over 30 organizations that work to ensure the voices of communities of color are heard as part of healthcare policy discussions. The training series was designed with Having Our Say's input, and through this series we hope to learn together and provide fundamental, foundational knowledge and tools around health equity advocacy and policy work. We invite community-based organizations who are interested in learning about advocacy, whether legislative, budget, administrative, direct action, or more, to join and share in this series. The last webinar's focused in February was called the Budget and Legislative Advocacy Part 1, which is a high-level. It was just a high-level webinar and focused on the basics of the legislative and budget cycles, key players that are involved in that cycle, and how to leverage policy through advocacy. This webinar panel will be comprised of going more in depth the leg and budget processes. So the goal today for part 2 is to dive deeper into the budget and legislative advocacy concepts with an emphasis on current state of California budget policy issues and the implications that those have for advocates. We're going to broadly touch on what the current state of budget and policy proposals that attempt to advance health equity in California are, what advocates should anticipate or consider in the period between now and June 15th when the budget needs to be signed, and what happens after June 15th when the budget is signed. Next slide. So before we get into the webinar, I'm going to provide a few housekeeping items. I'd just like to say that we invite your comments and questions, so please look at your Q&A chat box on your screen, and if you can think of any question for the speakers at any point, go ahead and just type them in there, and I will pose it to our speakers at that time or hold it for the discussion portion at the end of our webinar. Today's webinar is being recorded, and we will be able to share a link with you after the event is complete, and we welcome you to revisit the content and share it with your colleagues. Please take a moment at the end of the webinar to complete a quick evaluation survey. We value your feedback. It deeply helps us to measure our work and to adapt it to the rest of our webinar series. Next slide. So we'd like to say thank you to our team. As you can see on the screen, we have a couple pictures of our team here that have been working on this webinar series. Myself, Marcus, Saili, who is in our Oakland office, Mihei, and Jillian. Mihei is in our LA office, and Jillian is also here in our Sacramento office. So we'd like to say thank you to our team. Next slide. Okay, so I'm going to go ahead and introduce today's speakers. We have Christina Lattes, who was born and raised in the Central Coast city of Ventura in California, and is the proud daughter of young parents. As Community Engagement Manager with California Latinas for Reproductive Justice, Christina is continuing her commitment to her community by creating a base of Latinx leaders that are empowered to support and advance reproductive justice issues for themselves, their families, and their communities. When she is not working or organizing, she is training as a professional aerial artist, teaching women how to feel empowered through movement and dance. Christina's going to go ahead. She's going to touch on what the current state of budget and policy proposals that attempt to advance health equity in California are for her organization. And we'd like to say thank you for joining us today. And I'm going to go ahead and let Christina start her presentation.
Awesome. Thank you so much, everybody. Everybody can hear me okay? Does that sound okay, Marcus?
Yep.
Awesome. Awesome. Well, thank you all so much for having us on the webinar. Again, my name is Cristina, Community Engagement Manager with California Latinas Reproductive Justice. We're also a strong member of the Having Our Say Coalition, so we're happy to share a little bit about our work and a little bit about what we're working on this year. So I wanted to start off by just giving you a little background about who we are as an organization. CLRJ is the first and only Latina-led reproductive justice organization in the state dedicated to honoring the experiences and stories of Latinas, Latinos, Latinx, to uphold the dignity of our bodies, our sexuality, and our families. We started in 2005 by a group of women who were working across different movements, immigrant rights, economic justice, labor, and we really saw a lack of kind of intersectional perspective to reproductive health in the state of California, specifically for Latinas. Latinas make up a big portion of the population in California. Now it's over 7.6 million. But although we represent a large population of the state, we really are falling behind around health indicators and education and the lowest paid, community of the gender wage gap. And so there really was a need to kind of really center in on this work, and our organization was founded then. We can go ahead and go into the next slide. Our organization works on a variety of issues. We focus in primarily on building Latina power, and really ensuring that our voices and our experiences are really centered in the policy process to really motivate agents to change. And so we do cultivate leadership. We do a lot of leadership development work. That's the work that I'm in charge of and really love doing, working with leaders, doing presentations for community organizations, campuses around reproductive justice, and the importance of really getting involved in the policy process, taking a space, demystifying it. As you all know, it's quite complicated and many layers, but we really try to break it apart so that it's accessible and really tell stories and at Sacramento and also in district, and really making sure that we're pushing research that reflects the true experiences of our communities, and that those experiences and stories and research and data really center and push forward system change through policies at the state level. So we can go to the next slide, please. So before we jump into a little bit about what we're working on this year, I really wanted to spend some time just giving you a little background of what reproductive justice is. Some of you might have heard of this, framework before. Some of you maybe the first time. So basically, what reproductive justice was a framework that was created by women of color in the 1990s. It was actually a group of Black women who came back from a health conference abroad. And really saw just the lack of really centering the experiences of women of color within kind of the national politics of the time. This is in the 1990s, when we were seeing a lot of, this is the Clinton administration, we were seeing a lot of work around healthcare, right? We're also seeing a lot of work around welfare reform at a state and national level. A lot of just, the free trade agreements with NAFTA, coming in at this time. So a lot of new policies really impacting the lives of our communities. And this group of women really saw the need to really center the voices of experiences of women of color, folks of color, and the folks that are really most impacted and marginalized by some of these policies, and really how they trickle down to our communities, and to ensure that our voices are not only heard, but also that the voices and the leadership of women of color and people of color are really centered. So we're not just, side projects of, maybe larger reproductive rights movements or civil rights organizations, that women of color are, have their stake, and they're also part of building the strategy as far as like visioning of what our movement will look like and what we want our communities to look like. So that's kind of a little bit of background of it, and it's grown since then. I'm going to go into the next slide, and I really want to talk about what it is and how it differs from kind of the way that we look at reproductive rights in the U.S. And so, reproductive rights and health is a really framework that come out of activism, come out of mobilizing folks together, really raising up the needs. Roe v. Wade being one of the most well-known reproductive rights of our time. But a lot of those rights kind of look at these issues from an individual framework, right? So that your individual access to these rights or health. And what reproductive justice does is really look at it from an intersectional perspective. So, we have these rights, but depending on who we are, where we come from, how much money we make, the languages we speak, the cultures that, we represent, our experience is different. And that's just, the way it is here in the United States. And, the current political climate, just looking at the news, you can just always see that there's always, communities that are being scapegoated, kind of isolated. And so reproductive justice really was a place to really come and bring our movements together, really uplift the wholeness of our identities, the intersectionality of our lived experiences, and ensuring that when we're talking about justice, that we're making sure to look at all aspects of reproductive health and rights. And so the first tenet, it's really based off 3 basic tenets. The first is the right to have a child, and so that is the right to, plan your children, having access to birth control, also having access to fertility treatments, having access to different ways to have children, and maybe if you're a same-sex couple, access to, adoption, affordable options, and also like preserving your fertility as well. Right to not have a child, and that, abortion come to mind first for me, but also, birth control, adoption again, just different just choices. When we look at reproductive justice, we're looking at the plethora of choices that we have to make decisions of our lives and bodies. And then finally, the last tenet is the right to parent the children we have in safe and healthy conditions, regardless of our age, our gender, our immigration status, our ability, our economic condition. So this is where we see a lot of this kind of broader issues that we all work on around, is there pollution in our communities? Is there a heavy presence of state violence? Maybe there's always eyes of police kind of patrolling our communities, violence against our communities. Those things all impact the way that we live our lives, who we parent, and kind of how we can live, thriving, fruitful lives. And at the core of reproductive justice is self-determination. So at the core of all of these elements is the ability for people, no matter who you are, where you come from, that you have the ability to make choices over who you love, how your health, how you want to, have your body treated, and that those decisions lie with you, your family, and those most important to you, and not in the hands of, a larger system or politicians or, special interests. And so that gives you just a little bit of background of what reproductive justice is as we kind of dive into some of the issues that we're working on this year. So we can go to the next slide, please. And okay, make sure I'm good on time. And so here, just a little slide that kind of really shows why, the plethora of reproductive justice. And, because of those 3 tenets and the important key element of self-determination, autonomy, the ability to make decisions, you could see that reproductive justice is very vast and diverse and includes all these different elements. Gender identity is reproductive justice. Freedom from violence is reproductive justice. Safe communities, reproductive justice. Disability justice is reproductive. So making sure that when we look at the concept of justice, it's not just, we're trying to get access to maybe, health for all, for example. We want access to health for all. We want Medi-Cal access for all. And, regardless of your status, that should be available to all folks. Yes. And then as we dive deeper into that, we know that, health access is not the end all be all, right? We need to also have great housing and healthy communities to live in. And so ensuring that when we push policies forward, when we work in collaboration, that we really look at our communities through the different levels of our identity, making sure that we pose policies and solutions that really uplift all those elements and not compromise on certain aspects of our lives. Okay, go ahead and go on to the next slide, and let's jump into kind of what drives us in our work around policy. So these are the main areas that we are working on currently, as far as when we're looking at different policies that we want to address or promote or sponsor. First off, promoting Latinx's access to reproductive health care and positive health outcomes. So this has been a big priority for us over time as we have worked on, just the Affordable Care Act and over the past 10 years. And now, seeing with the current administration, all of the attacks at the federal level, at the state level, and how they're trickling down to our communities to ensure that we have access to health care and positive health outcomes. Again, highlighting that Latinos in particular and Latinx in California, although we make up large portions of the population, we're not representative in, positive health outcomes. So prioritizing that. Also, a major part of our work is promoting the reproductive health and justice of Latinx youth, of young people, through our Justice for Young Families initiative. So really doing culture shift work and pushing back against the way we look at young parents and youth sexuality, and instead of stigmatizing young people, instead of shaming them, instead of keeping them in the dark and keeping them away from access to information, that we empower them, we give them access, and we have conversations so that they're able to live fruitful lives. And if being a young parent is their choice, then providing them with support so that they can be successful and their families can thrive. And then finally, the center of our work, making sure that Latinas are mobilized and are a part of this movement, and we really advance it through collaboration, working across movements, through really uplifting the personal priorities of our leaders and their experiences. Okay, let's go ahead and go into the next slide. So this is just overall kind of what guides our work when we're looking at policy, ensuring that these principles are highlighted. And now, as all of y'all know, or some of you may know, this year we saw a lot of policies come through the legislature. And so it's a very, very difficult process to prioritize what we're going to work on, especially given reproductive justice is so vast and includes so many different issues. We're very eager to want to be a part of everything because it's all so important, but we do have a limited capacity here at CLRJ. We're a small team. We're about 10 folks. We have about 1 or 2 people dedicated to policy, and with constant budget constraints and just different challenges, it gets tough to work on everything. So this is kind of how we look at policies and really kind of hone in on what we're going to focus in on. And so one of the things that we do is identify in our organization through strategic planning what are areas that we want to grow in, where are we falling short, where are things that we need to learn as advocates and organizers. And so at CLRJ, we've identified different issue areas based off of the work that we've been doing with community about what we've been hearing. And these are issues around mental health. These are issues around interpersonal violence and domestic violence, LGBTQ plus liberation. These are all areas that we advance our analysis and our framework. And so when we're looking at different bills that are out there, do these line up with that, and prioritizing those over maybe another bill that is highly saturated with a lot of support, and we really want to hone in on those areas that we want to grow, and also, as you can see the next point, how we can add value. So if we have a bill that has broad support across different coalitions, everybody's on board, we might look at that bill and say, there's wide support here. What can we add, on top of just additional support, letters of support, additional folks, to be present? Is there a unique way that we can highlight reproductive justice? Maybe it's a criminal justice bill. We really want to highlight the impact on communities and really highlight that intersection. So really looking at how we can add value versus just kind of being present, and when we prioritize different bills. Also looking at, bills that legislators that we want to build with are kind of sponsoring. What are the priorities of legislators that we want to build with? Yet the other day we want to build more support and build more reproductive justice champions at the legislative level. So looking at those folks that are showing interest and kind of working with them, supporting with them, hearing what their challenges are, and trying to kind of provide any support to build better relationships so that when we have policies, we can count on them to push them forward and also sponsor bills. And then finally, the last ones are just, bills that our coalitions and our partners are sponsoring, having our say, has a great platform of different bills around health equity, specifically around Medi-Cal, making sure that documents are readable and are translated properly, that we have API data disaggregation, that we're tracking data around mental health. Those are issues that are very important to us, and we really want to support our partners on. So, and then finally, different grants that we have opportunities, we definitely support bills through that way. And then just different opportunities just to provide more visible support. Maybe a bill isn't getting a lot of visibility, and so we'll jump on to kind of raise up the profile or bring a different perspective. Go ahead and go to the next slide, please. And so based off that, this is where we landed this year with our different policy priorities. The two bills that you see there at the top are the main bills that we're focusing on this year. AB 1764 by Assemblywoman Carrillo, reparations for survivors of forced or involuntary sterilization. I'll go into that one a little bit more next, but I want to highlight SB 24, which is by Senator Connie Leyva, college student right to access. So this is ensuring that all CSU and UC campus student health centers have medication abortion access available for students. And then finally, you could see the last one, Health for All, which many of us are working on through different coalitions over the past few years. And that one's definitely a priority for us here at CLRJ. Okay, let's go ahead and go into the next slide, and I'll dive into a little bit about kind of the story of how we kind of landed with AB 1764. And this one's an important one, given that there's a budget strategy as well attached to this one. And so AB 64 came to us as here in Los Angeles. There's history around forced sterilization at the LA County USC Hospital in the 1960s and 70s against Mexican immigrant women. This was part of a broader, population control movement in the U.S. at the time, eugenics movement. And so there were filmmakers that were doing research around this and really wanted to tell this story, reached out to CLRJ that they were doing this work. And we really got involved because we really wanted to highlight that this isn't just something that happened to, this group of women in this lawsuit that ended up happening, but it was something that was broader. It was a historical moment here, not only in Los Angeles, California, but nationally, a historical moment of reproductive oppression against communities of color. And we really wanted to highlight that as a lessons learned in our history. And we really got involved in, once the film was done, in screening the film, presenting it in different spaces, showing it to partners, community, using it as a tool for education to really highlight what reproductive oppression looks like and how, just a small group of folks can come together and really create systematic change. And so and throughout that work, we were connected with the Disability Rights and Education Defense Fund, which is doing research across the nation around forced sterilization. In two other states, there was work around putting a bill forward, North Carolina in 2013 and in Virginia in 2015. And they reached out to us, given that California had, of the 60,000 sterilizations that happened during that time, 20,000 were in California. A third of them. And so really needing to kind of bring to the forefront and highlight how this, atrocity happened, this injustice happened to Californians, by our government. And so we worked with them to introduce SB 1190 last year, and that was introduced with Senator Skinner. Unfortunately, it was not included in the governor's budget at the end of the year. It was a small, in our minds, it was a small, couple of $1 million ask in providing basically reparations to these victims of forced sterilization. But unfortunately, it was not included, and many different reasons why we thought it might have not passed last year. Senator Skinner was a last-minute person that got on the bill, given that the original sponsor was no longer able to carry it. They didn't have a capacity in their office, and given that it was just CLRJ and DREDF pushing it forward, it was really tough on our team, to really do this work, and really needed broader support. And so this year, we've reintroduced the bill with Assemblymember Carrillo as AB 1764, and we're really trying to beef up our budget advocacy ask. And we've also added compensation for survivors in women's state prisons. So in recent years, there was a report done throughout 2006 and 2010 by the ACLU that showed that about 250 folks that were in women's state prisons were involuntarily or forced sterilized while they were incarcerated. So we're also including this element into the bill. And also this brings in a wider coalition of support that our folks are working around prison abolition and criminal justice are now kind of jumping on board. So we have a stronger kind of base of support to push this forward and do advocacy with the budget committees and such. All right, let's go to the next slide, please. And I think this is the last here. So yes, thank you. That gives you a little bit about who we are as an organization, what reproductive justice is, and a little bit about how we go about prioritizing bills, and this bill in particular that includes budget strategy. And I'm sure Scott will give us a lot of great information about kind of what that process looks like in detail. But I'd be happy to answer any general questions about our work or the bills probably at the end of our presentation. Thank you.
Awesome. Thank you so much, Christina, for your presentation. That was definitely a very informative one. So we're going to go ahead and move on to our next presenter, who is Scott Graves, who joined the California Budget and Policy Center in 2002, served as Director of Research since 2014. In his role, he oversees the Budget Center's analytical work, conducts research and analysis related to health and human services and corrections, and is the organization's lead analyst on the state and county budget processes. Scott received a PhD in political science from the University of Texas at Austin and a bachelor's degree in government and journalism from CSU Sacramento. And Scott's going to be touching on what advocates should be anticipating and considering in the period between now and June 15th, and what happens after the budget is signed after June 15th. So thank you for joining us today, Scott.
Thank you, Marcus. And I want to make sure you can hear me. Am I coming through loud and clear?
Yes, you are.
Okay, great. So thank you very much for including the California Budget and Policy Center on this really important health equity training series. We love talking state budget process, and so I always appreciate an opportunity to do so, largely because, as I've talked to people over the years, the state budget process, for people who haven't been through it or haven't been through it many times, can be confusing and sometimes intimidating. So we sort of see our role as helping to raise up some key points in the budget process that all advocates should be familiar with, so that they can make their voices heard effectively in our state budget process. I should say that in case you haven't seen them yet, our website has a lot of process related publications that I would urge folks on the webinar to check out if you haven't already seen them. We have guides, we have infographics. A few months ago, we put out a new guide explaining the relationship between the state budget process and the policy bill process, which has its own level of complexity. But today, what I want to do really is just focus in on the state budget process as it's unfolding over the next few months. The goal really is just to help take some mystery out of the process coming up, and also to highlight some opportunities for involvement that advocates have in the coming weeks and months. So next slide, please. So the most important thing, well, actually, there are two very important things to keep in mind generally when you're thinking about California's state budget process and the big picture. The first is that budget decisions are made year-round. They're made both in public, for example, during committee meetings, during open session, and they're also made behind closed doors. So that's sort of the first key point that all advocates should keep in mind about our state budget process. The second key point that flows from that is that advocates really have a lot of opportunities to make their voices heard in that process throughout the year, not just the part of the year we're in now, but sort of the quiet time during the second half of any calendar year, which I'm going to be talking about toward the end of my presentation. So if we go to the next slide, we're going to see the Budget Center's effort to put the state budget process on an infographic, basically on a single page. And one thing that I should highlight, I'm not going to spend a lot of time on this. I don't expect everyone to be reading it all right now. We do have it on our website, and if you're in Sacramento, feel free to stop by our office to pick up hard copies of this if you would like to. But what I really wanted to point out here is we did not do the standard linear budget process infographic. A lot of groups who talk about or show the state budget process, it's sort of an arrow that runs from left to right, and there's a starting point and there's an ending point. And it kind of gives the false impression that the budget process is this very straight linear process that clearly ends in one place and clearly ends in another place. And actually, that's an inaccurate picture of the state budget process. The reason our depiction is sort of circular is because the process essentially is never ending. There's always someone in Sacramento who is doing something related to the state budget, thinking about this year's budget, thinking about the budget for the upcoming fiscal year. And so what our infographic attempts to do here is just to highlight the key roles of the governor, the legislature, and the public, and just to show some of the critical events and deadlines that happen with respect to the state budget process throughout the year. So as you're thinking of the budget process, sort of get out of your mind that idea that it's a straight arrow going from one place to another with a real end date where you can go to the beach and forget about the state budget for a while. If you want to be influential in the state budget process here in California, particularly here in Sacramento, you need to think about it as a year-round exercise, a year-round engagement with that process. So if we go to the next slide, you know, many of you are familiar with the ways that you can engage the budget process or even the policy bill process. They're similar. Obviously, there's writing letters of support or opposition, and in these days, they're largely being submitted through online portals directly to committees in the legislature. You can also stand in line and testify at committee hearings, budget committee, or even policy committee hearings, obviously. That's a key way that advocacy groups can make their voice heard in the state capitol. The lower picture here with all the people in front of on the west steps of the state capitol, this is another classic way that people can engage, which is sort of holding lobby days events. If you're up here in Sacramento, you'll notice that this time of year, there's always something going on the west steps of the Capitol, and even sometimes, you know, the east steps and the north steps and the south steps all at the same time. So there are always people coming to the Capitol, getting their groups together, rallying behind a particular bill or budget ask, and then flooding into the Capitol to meet with lawmakers and budget staffers or policy committee staffers. So that's a really important point I want to emphasize here, which I really can't show through a picture, which is the importance of relationship building. I mean, you can send as many letters as you want. You can show up as many times outside the state capitol holding rallies. You can do all that. But if you haven't built the relationships with the key lawmakers and the key staffers in the state capitol, it's going to be much harder to move your agenda forward, either through the budget process or the policy committee process. So let's turn to the budget process as it's coming up in the next several weeks. Next slide. So first I'm going to focus on where we are now, late April, heading into mid-May. So this time of year, and many of you probably already know this, the legislature's two budget committees in the Assembly and the Senate, their subcommittees, and I'll get to that in a second, have been reviewing the governor's proposed budget that was released in January, which is for the fiscal year that begins this coming July 1st. So it's the 2019-20 state fiscal year. So there already have been dozens of hearings that got underway sort of late February, early March. They've been going on throughout March and April, and they will continue into early May. During the same period, the Department of Finance, which works for the governor and answers to the governor and essentially organizes the budget process within the governor's administration, they are wrapping up the governor's revised budget that will be released within the next 3 weeks, sometime in mid-May, and is commonly referred to as the May revision. So let me dig a little deeper on each of these points. Next slide. So within the legislature, as I mentioned, there are two budget committees. In the Senate, it's called the Budget and Fiscal Review Committee, and it's chaired by Senator Holly Mitchell. In the Assembly, it's just called the Budget Committee, and that one is chaired by Phil Ting from San Francisco. A couple interesting things about these committees. Each committee is broken up into a number of subcommittees. So in the Senate, there are 5 budget subcommittees. In the Assembly, there are 6 budget subcommittees. So the members of the subcommittees are really doing all the hard work of digging into the proposals that the governor made as part of his January proposed budget. And you can tell how important these committees are based on how many members sit on each committee. So the state Senate has a total of 40 members. 18 of those members, almost half, sit on the Senate Budget and Fiscal Review Committee, and then its various subcommittees. In the Assembly, which has 80 members, 31 members sit on the Assembly Budget Committee. That's over 1/3 of the membership of the Assembly serving on the Assembly Budget Committee. So it kind of gives you a sense of how important the budget committees have become over the last several decades as vehicles for getting policy done in California. I think some people would argue that a few decades ago, while policy committees are still important, they had even more importance perhaps than they do today, because they were seen more as vehicles through which you could do major policy changes. In recent decades, major policy changes and even minor policy changes have been flowing through the budget process as opposed to the policy bill process. So if we go to the next slide, we can dig in a little deeper on this thing we call the May revision. So the May revision, according to state law, has to be released by the governor on or before May 14th. So that's not in the state constitution. You may be familiar with the fact that the governor is required to release the proposed budget in January on or before January 10th. So that's a date that you will actually find in California's state constitution. The constitution doesn't speak to the May revision. That's something that was sort of set out in state law through the government code. But the date is set at May 14th, and governors will typically release the May revision right on that day or a day or two before. It's not clear when Governor Newsom is planning to release his May revision. We've been hearing possibly a hair before May 14th, since May 14th is a Tuesday, May 13th is a Monday, so there's a chance that it could come out on Monday the 13th. There's also a chance it could come out that Friday before, the 10th. But at this point, we just don't know, but the governor is required to release it by May 14th. So what the May revision is really doing is a few things. First, it's updating the governor's economic and revenue outlook. So back in January, the governor had some expectations about how well the economy would be doing over the next year or two, and how our state revenues would be doing largely as a result of the economy. Those are going to be updated based on more recent numbers, including the fact that Californians have now paid their state personal income taxes for the 2018 tax year. Everything obviously was due this month by April 15th, just a couple weeks ago. So those numbers have been coming in, and there's actually some good news there in the sense that the dollars coming in for April for the personal income tax have been exceeding the expectations set out in January. We did have a little bit of a shortfall earlier in the year of around a couple $2 billion. So it seems like the revenues that have been coming in April from the personal income tax are allowing California to make up some or all of that gap that opened up in the revenue projections earlier this year. So that's good news in terms of going into the May revision with a really, what looks to be a really solid revenue situation, which means we can have some more robust funding of really critical public services in the coming fiscal year if lawmakers and the governor choose to do that. A second key thing that the May revision does is it updates the Proposition 98 funding guarantee for K-12 schools and community colleges. Many of you may already be familiar with this. Voters approved this back in 1988. It's essentially a set of complex formulas that we put in the state constitution that determines how much state general fund revenue goes to K-14 education each year. And that's a really important number to know because you can't know how much money at the state level is available for other services until you know what the Prop 98 guarantee requires to go to K-12 schools and community colleges. So the governor will be updating the results of that formula with the changing inputs in May. And then the governor's also, in the May revision, going to be revising the expenditures that he proposed back in January to reflect various changes. So for example, in January, they might have assumed the Medi-Cal caseload was going to be 13.2 million. Maybe now they think it's going to be 13.1 million, which means they would need to revise their spending for the program. There could also be new assumptions about enrollment in higher education or K-12 education. And there would also be new estimates related to population, both the estimated state population as well as, for example, how many people we think may be in state prisons in the coming fiscal year, which would affect our state corrections expenditures. And then in addition to all that, through the May revision, the governor will be revising, adding to, or taking back some proposals that he made in January. So for example, as you all know, I'm sure, he proposed a relatively modest expansion of Medi-Cal eligibility to young adults, right? We did kids a few years ago. He said, hey, let's take this a few years up the scale. Let's do 19 to 25-year-old undocumented adults, as long as they're already, otherwise eligible for Medi-Cal. Let's allow them to enroll. He, in theory, could come out in his May revision and say, you know what, let's go further. Let's go up to 35, 40, whatever. He could add seniors. Essentially, he can do anything he wants in terms of revising the big or even small proposals that he made back in January. Next slide. So after the May revision comes out, then we get into a period in which things start to move a lot faster and maybe become a little less transparent than they've been in the previous months, where sort of subcommittees were diligently working in public settings to understand the governor's proposals across a range of issues for the upcoming fiscal year. So after the May revision is released, that subcommittee work being done by the budget committees in each house, their work will continue. They will hold some public hearings to try to understand what's in the May revision and the key changes in the May revision. Those hearings will be held, sort of in the week of May 13th and May 20th, but they'll try to wrap those up fairly quickly because what each house needs to do is to finalize its own version of the budget. So Governor Newsom essentially has proposed a budget blueprint that he thinks would be a great idea for California in the coming fiscal year. Lawmakers are generally in agreement that he's on the right path, at least in the majority party, but of course they have their own ideas, and they, in some cases, would like to go further than the governor has gone on some key proposals. So they're going to make these kinds of decisions as part of their own budget. In other words, the Assembly's version of the budget and the Senate's version of the budget. Of course, they're going to make different decisions. Sometimes the houses do exactly the same thing. Other times they move in the same direction, but they don't use the same wording or make the same assumptions or provide the same level of funding. So those create sort of disagreements between the budgets in each house. What generally happens then is during very late May into early June, the Assembly and Senate appoint a budget conference committee that whose job is to iron out the differences between the Assembly's version of the budget and the Senate's version of the budget. Of course, in the meantime, behind the scenes, they're also talking to the governor and the governor's staff and trying to get a read on where Governor Newsom is with respect to particular issues. And a lot of this is really a lot of the final negotiations that happen. There will be various people in the room, but it really comes down to next slide, what's called what we call the big three in California. Essentially, this is Governor Newsom, Senate President Pro Tem Atkins, and Assembly Speaker Rendon. These are the key players who, at the sort of the end of the budget process, at least as this transparent process heading into June, have to make some key decisions on some really big ticket items. Often they'll be able to settle the smaller stuff, but when it comes to some of the bigger proposals that are coming out of one house or the other house or both houses, or one of Governor Newsom's proposals that maybe didn't quite get the reception he was hoping for, it's really up to them to decide how they're going to iron out those differences and resolve to find a single budget bill and entire budget package that they can move forward on the timeline that's really set out in the state constitution. So let me switch to that now if we go to the next slide. There is a key deadline, another key deadline in our state constitution, which is June 15th. Our constitution says the legislature must pass the budget bill by midnight on June 15th. Now, this does not apply to trailer bills. Trailer bills are essentially bills that accompany the budget bill. They look really just like other bills. If you've seen other kinds of policy bills that move through the legislature, they're really not any different. They look the same, but they're intended to implement the changes that are assumed in the budget bill. So if the budget bill adds funding to a particular program or department or cuts funding, you'd have to find usually somewhere in the state code or state law where those cuts or new funding are going to be implemented. In other words, are we going to make more people eligible for something? Are we going to cut eligibility for a program in order to save money? So the trailer bills in most cases are giving us a roadmap to how the assumptions in the budget bill are going to play out in state policy, in state law. So if the legislature fails to pass the budget by midnight on June 15th, there's actually a penalty in law that's been in place since 2011. They would forfeit their pay and per diem, which is their reimbursement for travel and living expenses, for every day that the budget is not passed and sent to the governor. So for example, if they don't pass it till June 22nd, they'd lose a week of pay and per diem, and they would not be able to get it back. Notably, since this penalty went into effect in 2011, the legislature has not once missed the deadline. So the legislature for, 9 years in a row now, has passed the budget bill and gotten it to the governor on time. This June 15th deadline does not apply to budget-related trailer bills. There can be in any budget package 30, 40, 50, sometimes 60 budget trailer bills, depending on what the legislature and governor are trying to do through the budget process. And perhaps if we're in a recession and they're trying to find ways to save general fund dollars and cut programs, that also generates more budget trailer bills. Those bills don't have to be passed by June 15th. They can be passed at any point, but typically many of them are passed by June 15th along with the budget bill, and other trailer bills then sort of trail along after that date and they get approved, for example, June 20th, June 25th, somewhere around there late in the month. And then what happens is the governor, assuming all has gone well, and that it's helpful if you have a governor and two legislative houses that are controlled by the same party. It doesn't mean they're always going to agree, but it makes it more likely that things will go more smoothly and that you'll have an on-time budget package. And so in this case, which we've had for the last 8 years under Governor Brown and the Democratic legislature, budgets were passed on time, bills were signed into law before the start of the fiscal year on July 1st. So we've had a number of on-time budgets since 2011, when after voters changed the rules so that budgets could be passed by a simple majority vote of each house of the legislature. Previously, some of you may recall, a 2/3 vote was required, and that made it very difficult to get on-time budgets. So let me switch now to, if we go to the next slide, what happens during the July to the fall period. So this is the period when a lot of people think nothing is happening related to the budget, but there's actually a lot happening, and it's very useful for advocates to pay attention. So what's happening in public is pretty much every August, the legislature comes back when they're, of course, trying to move thousands of policy bills through the process as well, but they come back to the budget. In other words, the budget package that was just signed into law 6 weeks before, let's say, before they went on vacation in July, they come back and they say, we need to make some changes to the budget that we just passed. So they may add some new spending, they may add some new trailer bills, there may be cleanup. Of course, there's often cleanup because things move quickly and sometimes things just need to be corrected. Some errors get through, some things are unclear. So a lot of this is happening through the regular legislative process during the month of August, and the governor is generally on board with all of this, and the governor will just sign this stuff into law. It's generally not much controversial, but some big changes can be approved as part of this sort of second bite at the apple in August when the legislature comes back around and reconsiders the budget that it just passed a few weeks before. In terms of what's going on behind the scenes, there's actually quite a bit. So this is the period, and it actually even starts earlier, maybe back in June, maybe sometimes back into May, where the governor's administration not only is concerned about the budget they're trying to get signed into law for July 1st, they're also thinking ahead to the following January 10th, in other words, 6 or 7 months later, when the governor will be required to release his proposed budget for the next fiscal year. So in this case, it'll be 2020-21 fiscal year. It seems like a long way off, and I guess it is, but really politically and in terms of state budgeting, it's not that far off. And the governor's administration, all the departments and agencies are already during this period thinking about what is the governor's approach going to be for his budget that will be his proposed budget that's going to get released this coming January, essentially 7 months from now. So this is a process that's not open to the public, right? There are no public meetings. A lot of the documentation cannot be obtained by the public, but it is an opportunity for advocates to try to engage the process, both behind the scenes with the administration and with the legislature. So let me say a little bit more about what I mean if we go to the next slide. So on the left here, again, we're in sort of the July through fall period. As early in this period as possible, advocates should be looking for opportunities to engage with administration officials. What's going on here is, the governor is powerful, but the governor is not a dictator. And there are people within the administration who may or may not agree with the governor's approach. The governor, in many cases, will attempt to put a lid on efforts to promote more spending, to get more program expansions in his proposed budget. But there are always people working within departments, agencies, boards, commissions, who of course want to do better, want to improve policies, want to do more. And so they provide opportunities for advocates to sort of, if you know the right people, to meet with them and give them ideas for what could be included in the governor's proposed budget in January, right, several months down the road, that would sort of line up with the policy agenda that your advocacy organization or coalition is angling for. So, and now often this may go nowhere, right? I mean, you'll get a meeting with someone and there may be no result from that, essentially because it gets quashed. The Department of Finance says, no, we're not going to do that. But there are cases where you could actually have some success, where you could have a sympathetic ear within the administration and they sort of send an idea up the chain of command and someone near the top says, yeah, actually that sounds reasonable. Let's go ahead and add that in the governor's January budget. That's really solid gold if you can get that done, because now you're in the governor's baseline budget released in January for the upcoming fiscal year. And instead of trying to argue for getting your idea in and having Department of Finance officials ask you, well, where are we going to cut in order to make room for your idea and to fund what you want to do? Instead, you've managed to get your idea built into the governor's proposed budget. So you're not arguing after the fact for getting in there, you're already in there. So it's really worthwhile thinking about, given what you want, what kinds of ideas you want to advance in the coming fiscal year. Is there a way that you can sort of meet with some members behind the scenes of the governor's administration in key departments and agencies, and maybe get them to be your advocates to voice support for your idea in a lot of these private meetings that are going to go on during June, July, August, and September in terms of building the governor's proposed budget. Then within the legislature, of course, they are also thinking ahead to the next fiscal year, even though they don't really have a big budget release that they do. But leaders in each house are thinking about what their priorities should be for the upcoming fiscal year. This is a great opportunity to be meeting with staffers in each budget committee, as well as trying to meet with budget committee chairs, other key members of the committees, maybe even the leaders of each house, just to sort of put your ideas out there or remind them of something you were pushing during the months or years before and how you're hoping to have that brought up again, and that they will prioritize your ideas in their own work, maybe hold hearings around those ideas. Same for meeting with budget committee staffers. This is an important time to be doing that relationship building, particularly since during the fall, it's likely that people will start to move around. So, they've been working for one committee for a while. All of a sudden, you have somebody new working on the budget committee staffing your issue area. You need to get in there and introduce yourself, set up a meeting with them. This is a great time to be trying to set up meetings because, of course, the legislature, really isn't doing much during this period. They're always working. There's always something to do, but they're not as frazzled as they would be during the January through June period, when it gets much harder to hold meetings and introduce yourself to people for the first time. So we'll go to the last slide here. I just wanted to use the last slide to say, as an opportunity to say, we're very easy to reach at the Budget Center. We provide a lot of technical assistance to advocates and other Californians who are interested in, understanding various policies, what policy changes would mean, how the process works. We have information on our website, and of course, you should always feel free to get in touch with us directly. You can email me, you can give me a call. We always try to help folks out because, one of our goals is to make sure that advocates who are fighting for good public policy, particularly to help low and middle income Californians, have a fighting chance. In order to do that, you need to understand the process, and you need to be armed with the facts that will help you push your good ideas forward. So with that, I'll conclude my presentation, and I'm happy to take any questions you might have.
Awesome. Thank you so much, Scott, for your presentation. So I wanted to say again, thank you, Christina and Scott, for your presentations. And we do have a little bit of time left for a couple of questions. And we did have one from the audience that I wanted to go ahead and pose. And this one, I think, will go to you, Scott. And this is just like in your experience as an analyst. Our question is, why is support for disabled children and adults being reduced in some capacities and not an area of focus for the new administration?
I'm sorry, what was it? Children with disabilities?
Yeah, so the question is, why is support for disabled children and adults being reduced and not an area of focus for this governor and the new administration?
Yeah, well, I'm going to have a hard time trying to answer that one. Obviously, I can't speak to the administration's view or priorities, and honestly, I haven't had a chance to look deeply enough into that particular part of the budget to know what's been going on. So, if I tried to answer the question, it would probably be a very unsatisfactory answer. So maybe the questioner can get in touch with me offline, and I can try to give them an answer offline or put them in touch with someone who might be able to help them out.
Awesome, thank you so much. And so we do have another question, and this one is for you, Christina. So how do you, as an organization, decide whether you want to pursue a budget ask along with a legislative ask?
Awesome, that's a great question. For us, it's really about the money, right? So if the policy that we're trying to promote includes some kind of monetary need, or there needs to be an investment. Like there's a sterilization bill, there's actually going to be, payments to victims of sterilization that go out. In other cases, it's, beefing up maybe, for example, we worked on a case called the Maximum Family Grant a few years ago to repeal welfare caps, and that was a need to increase the CalWORKs budget, right? So more folks have access to CalWORKs. And so whenever there's a money asked, there has to be a budget strategy, and that's something that we learned from experience through that bill and through this bill as well. Having both we're doing the legislative aspect, we're making sure we're informing legislators about it, and the policy aspect is it's a lot easier to harness community support around versus like the budget process. Scott was mentioning there's a lot of administrative kind of meeting pronged approach to hit from both angles. Yeah.
Awesome. Thank you so much. And then we have time for one last question. And so this one is to you, Scott. What are in your professional experience and in the analysis that you've done, what are some possible ways to pay for another healthcare coverage expansion?
Yes, healthcare coverage expansion. So with any expansion, there are a couple of ways to think about it. One is it small enough that it could be sort of squeezed in to the budget for the upcoming fiscal year without requiring any tax increases? So generally, as long as we're in a period of economic growth, which we have been for the last 8 or 9 years, California's revenues will grow from year to year. And so the question is, how do we as a state allocate those growing revenues? And some of them can be used to expand programs. So a good example of this is the expansion of full scope Medi-Cal to undocumented immigrant children and youth through age 18 a few years ago. There was no tax increase that was associated with that. The legislature and governor made the change and built it into the budget and just sort of absorbed that cost within the state budget each year going forward. So there was no particular revenue stream that was tied to that. It was just thought to be, a wise policy choice. They made the choice to do it, and they paid for it out of tax revenues from our existing state tax base. It gets a little trickier is if you want to do really expansive proposals that get into hundreds and the high hundreds of millions of dollars per year, $1 billion, $2 billion. So for example, expanding Medi-Cal eligibility full scope to undocumented immigrant adults age 19 and up has been estimated to cost anywhere from $2 billion to $3 billion per year ongoing. That's the kind of cost that would be difficult to absorb in a single fiscal year in our state budget, just because in order to do that, you would have to make decisions not to fund a lot of other, really important policies and program expansions that, other advocates are hoping for in the coming year. So often what happens then is you need to look for new revenues. And, the best place to look for new revenues is our personal income tax, because we have a progressive tax that grows typically from year to year. Sometimes you might look at the sales tax, and then there's also the corporation tax. Those are essentially the big 3 taxes that fund most of our general fund supported services in California. So that's sort of where you would need to look. One thing I wanted to leave you with was that there's been a debate about whether California should renew its managed care organization tax or MCO tax. I'm not going to say much about this. It's very wonky and complicated. But essentially what this tax does is allows California to leverage more federal dollars and reduces our state general fund costs from Medi-Cal and allows us to use the dollars we save in California to expand in other areas. So that's been, that's an opportunity that California has. Our current MCO tax expires on June 30th, and the Newsom administration has not committed to seeking a renewal from the federal government of this tax. Health Access, SEIU California, the California Immigrant Policy Center are now all out there saying California should be seeking a renewal of this tax, because if we do, we essentially free up around $1.5 billion every year that the tax is in effect that can be used to pay for particular programs and services, essentially whatever the legislature and governor want to use those dollars for. But you could argue money generated by the MCO tax or the state savings can be redirected to, for example, a pretty big expansion of Health for All, or creating new subsidies to make coverage through Covered California more affordable to middle-income families. So there's a lot of things that can be done with those dollars. The only way we can get them is if we ask the federal government to renew the MCO tax for a maybe 3 to 5 year period. If we don't do that, essentially we're leaving over $1 billion on the table every year that could otherwise be used to fund really important program expansions in California. So if folks haven't had a chance yet to think about or dig into the MCO tax issue, I would urge you to look into that because it's something that California really should be pursuing if we're serious about bringing in ongoing revenues to support very important program expansions.
Awesome. Thank you so much. And that will wrap up our Q&A portion. I just wanted to take a quick moment to say thank you to our two presenters today, and wanted to thank everybody for attending the webinar. Please take a few moments to complete the short 2-minute evaluation. Your feedback is very valuable to us. The webinar recording and PowerPoint presentation will be sent to you via email in the next week, and I'd just like to say thank you for joining us today.